This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Hello, I'm Dr. Michael Laidlaw. I'm an orthopedic surgeon with Mercy Health. I provide knee and shoulder replacements, but I'm also sports medicine fellowship trained and provide open and arthroscopic complex shoulder and knee procedures. Knee pain actually comes in so many different flavors, about as many as Grater's has for ice cream. When you look at knee pain, you can have sports-related injuries, and those could range from either being a collegiate athlete to a professional athlete, or even your weekend warriors. Or it could be as simple as actually having pain that comes from everyday activities of daily living. Getting in and out of your car, getting in and out of the shower, even playing with your kids or grandkids, and getting off the floor. It doesn't take much to necessarily sometimes tip a knee that might be at risk over the edge, and then you start having pain. When you look at osteoarthritis, it really is a spectrum when you look at the health and of a knee as it works through its overall age and progression with you as you live your life. If you want to think about basically an egg and think about how smooth it is, that egg could be the more normal native knee in terms of how it looks with its smooth texture. Then you want to think about a cobblestone road. That's a little bit more than what we start seeing with regard to arthritis and how it presents itself with pain when patients are in the office. So non-surgical treatment options really at the end of the day are a huge amount of what we do and provide as orthopedic surgeons. Just because you're coming to see an orthopedic surgeon does not mean you're looking at surgery. Really, our job at the end of the day is to make sure that you're educated as a consumer to your healthcare and that you know the options, and we work with you. And what I really enjoy doing is developing patient-centered and centric treatment plans that allow you to be able to get back to what's important to you. So when we look at things that are non-operative or conservative in nature, there's a spectrum of what options are there. I think it's also important to talk about what are you looking at for your goals. There's different reasons for why a patient might be indicated for one more than the other. And I think getting down to really having that discussion with your surgeon or healthcare provider to be able to understand the risks and benefits for each and what each could be able to provide you is really at the crux of what we're trying to do. So when we look at what potential treatment options are available that might be from a knee preservation or even a knee restoration approach, as I'd mentioned, sometimes it can get to be a cobblestone road. When it's at its most extreme and involves the entire knee joint, that's a little bit more appropriate to have the discussion of a definitive treatment such as a knee replacement. But when it comes to preservation or restoration for small injuries that are associated with the knee, you can look to do a couple different things. One, we could look to actually harvest some bone and cartilage from another place in the knee using your native tissue. It's called an osteochondral autograft transfer. On another extreme, moving away from bone and cartilage related restoration procedures, we have things like matrix-assisted autologous chondrocyte implantation, otherwise affectionately known as MACI. So we're on the third or even moving into the fourth generation for this at this point and looking at how to be able to do this as a two-stage procedure. You basically come in and we go to the operating room to be able to then harvest a small section of your cells as cartilage and really allows us to be able to grow up those chondrocyte cells and then implant them in a matrix. And then we come back for a second procedure that allows us to work on that very focal cartilage-based injury, and we allow it to be able to be done for all of these procedures as an outpatient procedure. Now, an important part of some of these cartilage preservation or restoration procedures is also looking at the alignment of your bones. Some patients have knock knees. Some patients have bow legs. So it really takes into consideration, do we also need to work on the angular vector or really kind of the shape or angle of the knees for how weight is being dispersed through them to be able to protect what was an actual preservation or restoration procedure. So if you're having pain in your knee or have questions that you'd like answered and you'd like to schedule a consultation with a Mercy healthcare provider, please don't hesitate to reach out. We can't help you if we don't know about it. The best way to reach out is 513-347-9999 or even online scheduling through mercy.com/Cincinnati.